All right, let's talk about something we've all gone through. You get a lab result back, you open it up, and it's just a bunch of numbers on a page. It can be super confusing, maybe even a little nerve-wracking. So today, we're going to break down one specific number you might see, your eGFR score, which is a huge indicator of your kidney health. So just picture this with me. You get that report, and there it is, eGFR 54. What in the world does that actually mean? Is it time to panic? Do you just shrug it off? This is the exact scenario we're going to walk through, piece by piece. Now, there is a very simple by-the-book answer for what a number like this means. It's the first thing you'd probably find if you typed it into a search engine, and it gives you a pretty clear label. But, and this is the key, that simple answer, it is not the whole story, not even close. The clinical reality, the one your doctor is actually working with, is way more nuanced, and honestly, it's way more helpful for you to understand. So to make this as real as we possibly can, we're not just going to talk in abstract terms. We're going to anchor this whole discussion around a genuine question that someone actually asked. It's the perfect way to see both sides of the coin. And here it is, simple, direct, and a question that thousands of people probably have. What does a GFR at 54 and creatinine at 127 mean for someone 60 years old? This is our roadmap for today. Okay, let's start with layer one, the quick and easy explanation. But before we can even talk about what 54 means, we have to know what eGFR even is. So eGFR stands for estimated glomerular filtration rate. Yeah, it's a mouthful. But all it really is a grade for how well your kidneys are doing their main job, which is cleaning all the junk out of your blood. The higher the number, the better they're working. Simple as that. So if you look at how these numbers are broken down, you can see exactly where 54 lands. Anything between 30 and 59 falls right into what's called stage 3A, and the official label for that stage is moderate chronic kidney disease, or CKD. Now, before a term like chronic kidney disease sets off any alarm bells, let's get some perspective here. This is incredibly common. About 1 in every 7 adults in the US has CKD. And the crazy part? Most of them have no idea, because it often has no symptoms. So this isn't some rare, catastrophic diagnosis. Okay, so that was the quick explanation. But now we get to the much more important part of the story. Because in medicine, one single number is almost never the final word. Think of it as a clue, not a conclusion. This is the rule you'll see plastered all over the internet and in patient handouts. It's a nice, clean, easy-to-remember cutoff. If your eGFR is under 60, you have chronic kidney disease. Seems pretty black and white, right? Well, yeah, but not really. That statement isn't technically wrong, but it's a massive oversimplification of how a real diagnosis is made. What actually happens in a doctor's office is a whole lot more careful. And this comparison just lays it out perfectly. A CKD diagnosis doesn't come from one bad test. A doctor needs to see that number stay low for at least 3 months. Why? Well, because a ton of things, like being dehydrated, having the flu, or even taking certain painkillers, can make your eGFR dip temporarily. It's not a one-and-done thing. And here's another one you'll see all the time, that any GFR under 90 means kidney damage. But that's kind of misleading. I mean, our bodies age, right? Our kidneys age too. It's totally normal for an older person's GFR to be in the 70s or 80s. It's only labeled stage 2 CKD if there's other evidence of a problem, like protein leaking out in your urine. So we've seen where the simple answer and the real clinical picture can differ. But now let's talk about the one thing where they are in 100% agreement, the vital link between your kidneys and your heart. You absolutely cannot think about one without thinking about the other. They're like a dynamic duo. When one of them is struggling, it puts a ton of stress on the other. And this is a two-way street. That's what doctors mean when they talk about a bidirectional risk. If your kidney function is poor, your risk for heart attacks and strokes goes way up. At the same time, if you have heart disease, it can harm your kidneys. But the good news, the reverse is also true. Taking care of your heart helps your kidneys, and taking care of your kidneys helps your heart. Okay, let's pull all of this together. Knowing everything we've just talked about, what does a real comprehensive look at kidney health actually involve? Well, it's about seeing the whole picture, not just staring at one number on a lab report. Your doctor is basically a health detective, and that eGFR number, that's just the first clue. They're also going to look at your urine, checking for protein. They'll look at your blood pressure, your blood sugar, and the medications you're taking. And maybe most importantly, they're looking at the trend over time. Is your eGFR stable or is it dropping? That trend often tells a much bigger story than any single number. So here's the bottom line. An eGFR of 54 isn't a final verdict. It's an invitation. It's the start of a really important conversation with your doctor about your health as a whole. A picture that includes your heart, your lifestyle, everything. And really, that's the question all of this leads to, isn't it? Our medical tests give us amazing, valuable pieces of data. But each piece of data is just one chapter. It helps tell the story of your health, but it is never, ever the whole story.